Hi, my name's AnnMarie Preik, and I am your host for today's Second Act Mamas podcast, a place where women in the second act of their life can come together to talk, laugh, cry sometimes, admonish about everything that this stage of life has to throw at you. So please help me welcome today's guest, Julie Beatty. I've known Julie for a long time.
Yep.
I was trying to figure out how long, because I know you from the Y. Like that was before Trinity.
And I think it was middle school, like when the kids were in 5th grade, and he had the game truck.
Oh yeah.
And you had started baking.
Yeah, because
Daisy
like
a business.
Right.
Yeah.
Okay. Because Daisy and Luke were in the same 5th grade class.
I think so. Yeah.
Yes, I remember because I was. This is funny. I don't know if I ever told you this. I remember because I was the room mom, and partly I was the room mom because I knew Luke was a handful. So like, I was the room mom for Mrs. Capelli 4th and 5th grade because anyway. But I remember every time I went in there, Daisy was like, had no interest in my son. She was just like so annoyed with him every single time. I got it. I totally understood. But anyway, I remember Daisy from a long time ago.
Yep.
Yeah. So, okay. And we went in Trinity Fitness. So a previous guest that we had, Natalie, knew her from Trinity Fitness too. So what we usually do is start out with rapid fire questions.
Okay.
So part of these is like, every question has something to do with like maybe an aspect of what you do for the second act of your life, right?
Right.
Okay.
Okay.
So when going on a trip, do you pack your whole closet or do you travel light?
I have a problem.
You have a problem? Which way is your problem?
I normally pack way too much.
Oh.
And sometimes I just don't know, I don't know, okay, like if we're going to the beach, are we wearing our bathing suits for part of the day? Then
Sure.
Are we changing? Are we changing in the morning? Are we changing in the afternoon? Do I need so I normally way over pack. And then sometimes pack things that I don't need. Like we went to Hawaii over spring break. And
You did? That's amazing.
It was
I
cold.
didn't know that.
Yeah, it was cold though. And so I had like one sweatshirt and I needed, I had to keep washing clothes because I didn't have cold clothes.
Where did you go to Hawaii? I didn't know that.
Hawaii. Yeah.
That's amazing.
Yeah. Well, I mean, we have family there, so we were visiting family.
That's right. I forgot you had family there. How cold was it?
It was it wasn't freezing, but for Hawaii it was windy and rainy, so it was high 60s,
Oh,
low 70s.
chilly.
So it was chilly enough, especially with the rain and the cloud cover and everything. It was chilly, so it was not what we were thinking we were going.
That's not what you envision when you go to Hawaii.
I put on a bathing suit to go in the hot tub, not to go to the beach.
Yeah.
It's
Hawaii is definitely talking about trips. Hawaii is definitely one of those bucket list trips. I would love to go to Hawaii. It's so far.
Yeah, no, it
takes forever to get there.
It does. It's a whole day of travel, and it's a whole day at it's 18 hours. By the time you get to the airport, check in, all that stuff, and then the time change difference, it's it's a lot.
Yeah,
but it's definitely worth it.
So that's why people go and they go for 2 weeks because it takes so long to get there.
Yeah, we were there for 10 days, but and adjusting to the time difference is a lot. Sure.
Yeah. So what is one aspect of motherhood you find the most joy in? And actually, I think I forgot to say this. She's a mother of 2.
Yep.
Daisy is a rising junior. She just started in college. Yeah. And then Donovan is a senior in high school, right?
A senior this year. Yeah.
Wow.
Yeah, I know.
Is that crazy?
It is. And the funny thing is I didn't have a hard time with Daisy. I knew she needed to go to college, and I knew she was ready for that next chapter of her life. Mm-hmm. But I think I'm having a harder time this time because I know that there's not going to be it's going to be me.
Yeah.
And the dogs, and that's it.
Yeah.
I'm going to be alone. So I'm having a harder time, just processing, I think, this.
It's a totally different, and I think it's different boys and girls.
Yeah.
It's all the things. It's very different.
Yeah.
Yeah, because we're sending Savannah off. So does he know what he wants to do?
Right now he's looking at UCF.
Okay.
He's not sure what he wants. He thinks some kind of engineering, but he's not really sure.
Does he want to do marching band too?
Yes.
Yeah, that's cool.
So he's got a ton of friends at UCF that are in marching band, so he's already
that'll be so fun.
He's already made plans for his roommates his sophomore year of college.
It's sophomore year? Okay.
Okay. Sure. Whatever.
That's funny. Okay, and I don't think I totally interrupted you. So what is one aspect of motherhood that you find the most joy in?
I think right now it's just seeing them succeed and in different ways. Like with Daisy, I think she's found like her purpose. Like she finally found like what she knows she wants to do with life, like where she's going to be happy, and found something that really is truly a good fit for her, which for a while she was going through all these different choices. And I'm like, this is not going to be like, you're going to be miserable. Like, please don't be miserable for the rest of your life, you know? But now with what she's doing, and she's just very, driven, like to see that, like just that drive like that she's got instilled in her, and you know all the things that she's doing, like it's amazing to see that. And with Donovan it's different because he's not quite there yet, but it's like through high school I've seen him grow in his music and how much he loves music, and it's just so much fun to watch him, like how much he loves it, like, and just finds joy in playing the guitar and just, you know, those kinds of things. So
does he play the tuba in the band?
He does. He plays tuba and marching band, but he can also play trombone. He can play the what's the other one called? I don't know. One of the
Trumpet?
other ones. No. It's like, it's a smaller tuba.
Baritone? No.
Baritone?
Yeah.
I think it's baritone.
That's a smaller tuba, sort of,
like
right?
a smaller tuba, euphonium, and then he plays electric acoustic guitar.
That's a new thing, right? Semi-new?
He started that when he was, I think he was 15 when we got him his first guitar, maybe 14, and he taught himself.
That's
like
so
he's
cool.
Completely self-taught.
That's awesome.
And he can play really well. And it's fun because he likes the same music that I grew up with.
Oh, that's fun!
So he's my concert buddy too. So it's a lot of fun. Like we have a lot of fun, like being friends, because it's just been the two of us for the past couple of years. So we've gotten a lot closer as far as being like, I don't know, we're like friends, and he takes care of me and I take care of him.
Yeah.
So he's my concert buddy.
So speaking of like the music that we grew up with, Austin and I are actually going to a concert, I think in 2 weeks. It's live.
Oh, we're going.
Are you really?
Yes.
That's amazing.
We'll be there.
Yeah. The only one I'm not really excited about is Soul Asylum.
Yeah.
I can just take it or leave it, but that's fine. But it's so fun.
So the funny story about this is we're going next week. It's a college trip up to Georgia.
Okay.
But we're actually going up there to see Green Day, and it's on Wednesday, and then we come back, and then I think it's Thursday night is Bush and Candlebox, and then Friday is the live in.
Oh wow!
Or whichever way it is.
I
don't know. It's STP.
No, I think it's Friday. STP live in Soul Asylum is the Friday,
and then Thursday is Bush, and so we have like 3 concerts in a row.
Oh my gosh, that's amazing!
but we're going on a college trip to Georgia.
Listen,
we're gonna see UGA.
He's a senior. Like, who cares?
I know.
Yeah, at some point, like, who cares?
Yeah.
Okay. So, what is one aspect of motherhood you find the most challenging?
Letting them make mistakes.
Ugh. Yes.
And knowing that it's a mistake, and also trying to deal with. I don't process emotions the same way as my kids, so it's really hard. Like if Daisy has some kind of meltdown about something and she calls me and she's sobbing and can't talk, like I really feel bad for her, but at the same time I'm like, I can't help you until you can like make sense, you know? And like it frustrates me, and I don't know how to come across the right way to not, you know, like I don't, there's nothing that'll calm her down.
Like to appear insensitive. You're not being insensitive, but to her she
but it's like I don't know what to tell you because I can't even understand what you're saying. Like you need to just like call me when you can talk, because I can't just listen to, like, I don't know, to me, like, listening to incessant sobbing on the phone is not productive. Okay. Like, it's just, and not that I'm insensitive, but, like, I can only take, you know, like, it's like after about 30 seconds, I'm like, okay, if we can't calm down enough, and most of the time it's not anything major, you know, like, if it was something that I knew, like, you know, the sky had fallen, or, you know, like, something that was really bad, like, that would be different. It's just more, sometimes she doesn't know how to process her emotions that she's dealing with, and she gets herself worked up into this frenzy, and then I don't know how to handle it. Yeah. And I find it really, really challenging to deal with that emotional side of kids.
It's your accountant coming out. Your accountant
side.
No,
I think it's just, like, more rational. Like, I'm very rational when it comes to, like,
you've had to be
feelings.
You had to be every aspect of parenting the majority of their life, right? So you kind of have to be that emotional maturity level, right?
Right. Like I can't, I don't, so I just process them very, very differently. Which is hard.
Is Donovan more like you?
He is more, it's funny because he is more of, like we had an instance that happened at school where a parent actually confronted him. And he shuts down. Like, he will totally break down and shut down where he can't function.
Okay.
Which is a totally different kind of reaction.
They're both meltdowns, but one is external and one is internal.
Yes.
Yeah.
Yes. Like, and came up to me and was just, and a lot of that has to do with his issues. A lot of it do have to do with things that happened when he was younger.
Sure.
And how he processes that. Because that's how he used to cope with any kind of, I don't know what the right word is, but discord, like fighting, anything like that, is he would go put himself to sleep. Mm-hmm. So he would just go disappear into a room and go to sleep, which is a totally different way of...
Yeah.
But when he's upset, it's really something serious. Okay. Because he's very even. Mm-hmm. Like, he's not one of those...
Sure.
He doesn't have, I don't know, the girl hormones. He doesn't have the highs and lows. Like,
yeah, and like you said, it's how we process our story, how we process the past, and like... Yeah. And then you can see that play out in current relationships or however, right? Yeah. Allowing, so that has been a recurring thing that the Lord has really brought up, like truly trying to hone that in, is allowing my kids just to make mistakes. Yeah. Like just watching it unfold. And, there's an element when they're younger where like you kind of have to jump in, right? And then when they're older, you're just like, okay, well, I guess I'm the consultant now, and they're not consulting me, so I guess short of like you said, something pretty drastic, you kind of just have to watch it happen, watch it unfold. You do, and you have to let them make those mistakes so they can learn, because that's the only way they're going to be. They have to learn to be a functional adult. Yes. And Lord willing, a successful functional adult. Yep. With healthy relationships and whatever, right? Yeah. 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 That's not easy. No, it's not. Yeah. No, I know. So you've already launched one and you're going to be launching another. Yep. So when launching kids, is it freedom at last or is it like Sobfest? Somewhere in between. Yeah. I have the freedom. They've been older for a while now, so it's not like I needed a babysitter to go out and hang out with my friend or do whatever I wanted to do. But at the same time, like, I think it's going to be empty. Like the house is going to be like kind of lonely. I'll still have my dogs, I guess. You have two? I have two. Yeah. And they're young. They're puppies. But, I think it might be quiet. Yeah, it's going to be the quiet. It's going to be like not hearing guitar or not hearing noise and just being like, oh, wait, it's just me right here. Yeah, it's going to be a huge adjustment. Yeah. I would think it'd be a huge adjustment. I think that's going to be tough. Like, and you work from home too, right? Mm-hmm. Yeah. Yeah, the only thing that probably keeps me sane is that I get out and I play tennis, so I go see people. But, sure. This year I'm not going to be seeing people because I'm having 2 knee replacements. So is that for sure? Because the last time we talked, it was like up in the air. Yeah. Yeah. Have you scheduled it? Yep, September 16th. Whoa, it's coming up. Oh yeah, less than a month, and then the next one's December. So wow, it'll be. But I figure this is the year to do it because he still is at home, so I'll have help. Yeah, for sure. For sure. Instead of being by myself and trying to... Which would be miserable. Yeah. Yeah. Wow. Okay. Yeah. So I don't know if this applies to you or not, so if it doesn't, you don't have to answer. Okay. But what is one symptom of perimenopause, menopause, or this whole thing that you weren't prepared for? So they tested my hormones when I had what we're going to talk about, everything done. I'm not even in perimenopause. Yeah. So have you felt any differently of like, oh, that's new? Not really. I think with all the problems I had going on, there was so much that all of that was just like in the way. Sure. So I haven't really noticed any like drastic, things. Now I have noticed, but I think some of this is because I don't have, I had a hysterectomy, so I don't have some of the I know I still have like my ovaries and have the hormones and stuff, but I think for so long I had, I had an IUD, so it was birth control of some sort. So I didn't feel like I had the hormonal fluctuations, which I think some of that has come back. Yeah. After having everything removed and not being on anything like that to control them. Like I can tell sometimes like I get
like a little bit angry in the middle of the month or something, you know, and I don't exactly know when it's going to happen or why it's happening, but it's like, it's more like I'm going back to that almost like a PMS kind of stage instead of
your body's like regulating to itself now, and it's going to be to a new normal, right?
Yep.
And I after like doing all this kind of stuff, I follow quite a bit of people on Instagram anyway. So I was talking, there was a doctor she's a urologist, who actually does a lot of the things that we're actually going to talk about anyway. But she was saying, there's no blood test for perimenopause. It's like, depending on how old you are.
Right.
And what else did she say? Oh, and a period doesn't matter. Oh. The period is like, you can still be in perimenopause and still have a period. A period doesn't really say anything or whatever. Right. Anyway, so it's like all these kind of things that I didn't know that. I was like, oh, okay, well, that doesn't really make any sense, but sure.
Okay.
You're smarter than I am, so whatever.
You have a degree.
Okay.
You have a degree in that.
Anyway. And it just goes to show just how complicated a female body really is.
Yeah.
It's not even on the same plane as how for men to like women.
No.
So much more complicated.
So much more going on.
So much going on.
So much more going on there.
Okay. Yeah. So you have been so gracious into agreeing to come talk about a hard, vulnerable thing that you have been through the last 3-4 years.
It's I was thinking about and I guess now I'm in the recovery stage of things. So, but from start to finish, it was probably a little longer than 2 years, but I think it was probably going on for much longer than that until I actually realized that there was an issue.
Yeah. So any mom who is like post raising kids, things like that, knows your body is never the same. Like, even if like just normal, like your body will never be the same. Every single cell has been affected by having babies. Even if it went totally smoothly, no problems, whatever. But unfortunately, with having babies, it's such like, I want to say trauma because that alludes to like negative, but I don't know how else to say it.
It's kind of trauma to your body.
Right. Sure. Yeah. And so because of that, some really hard things can happen because of that. Post-baby, I don't know, probably like post-30s or whatever, when things like gravity starts to take over.
It's like when your muscles, like when, you start getting wrinkles, so your skin, like, you're losing like your elasticity, you're losing like your muscle tone, your tightness.
Collagen.
Like,
whatever.
Like all of that stuff. It's kind of like that time period, which I think for a lot of us is like mid to late
40s. 40s is usually when you start to notice it.
40s is when like everything just...
I tell you what.
I started noticing and I was like...
From 39 to 40 I woke up and I was like, oh, that's different. 45 and I was like, oh, what is happening?
45 has not been kind after 45. Like this downslide to 50 is not going well.
So I turned 50, so I'm 48. I'll be 50 in a year and a half.
Yeah, because we're about the same age.
Yeah, because we're November, right?
I'm January. So
okay.
I'll be 48 in January.
Oh, that's right, because she has the same birthday as my daughter.
Yes, I do.
That's right. So because of that, there's a lot of possibility for pelvic floor dysfunction.
Right.
And that's a wide range of like things that could happen.
But I probably had them all.
Gosh, you could be a case study. It's so terrible. Anyway, okay, so when did you first notice something wasn't right?
So going back and thinking about, I mean, my first like moment where it was like, there's something wrong.
Yeah.
I mean, I was taking a shower and I was bathing and I was like, what is going on? Like, what is this thing between my legs that's not supposed to be there?
Yeah.
And I'm in the shower and I start freaking out, and I'm like,
right.
And the best way I can describe it, which is kind of weird, is that I was like, do I have a blister? Like what is this? Like, what is this thing? So of course, I'm Dr. Google and I'm like trying to figure out what's
good
going on.
And bad.
I'm like, do I need to go to the emergency room?
Right.
Like I have something coming out of me that's I know is not supposed to be there. Like, what is this?
Sure.
Like, do I have a disease? Like, am I sick? Am I, is everything just going to come out? Like, no one talked about it, so I didn't know.
And you're panicking and you don't have who you're going to ask.
And I'm like, okay, so it's the middle of the night. Like, oh, it's late. It wasn't the middle of the night, but it was a weekend and it was late. And I'm like, okay, I don't want to go to the emergency room.
Sure.
So, which is the doctor Google. And I did find what it was on there, which was a cystocele, which is basically your bladder falling out. Like, it doesn't fall out per se, but the muscle has lost its tone inside and it pushes against your vaginal wall, and then
so it just like drops.
It just drops. So what's actually hanging out of you is muscle. It's not,
okay.
You know, your bladder is pushing, causing the bulge, but the actual thing that you're feeling or seeing is muscle.
Okay.
Which is your vaginal wall.
Right.
Falling out.
Right.
So that was the first time that I was like, there's something, like, I need to get something taken care of. Like, this is not okay. Before that though, I had symptoms that I didn't know about, like, you know, like, and I just thought like, oh, well, my bladder's just like, I have to go to the bathroom a lot. Like, you know, like every time I stand up, it's like, okay, where's the nearest bathroom? Like stuff like that. My kids, they would laugh at me because at Disney or something, they'd be like, you know where every single bathroom in Disney is? And I'm like, you better believe I know where everyone is because I have to stop at every single one as we're walking. I'm like, wait a minute. And they're like, we spend half our day while you go to the bathroom. And I'm like, okay. And then just some other things too that had started happening that I didn't know were related, like, and this is really embarrassing to say, but I would just have little pieces of poop fall out of me, and I'm like, I don't know why this is happening. Like, is something wrong with me? Like, but it wasn't enough that it was like, okay, like I need to go see someone about this. But you know, you're walking around and you're like,
that's not normal.
Without control, like no control over it, like not knowing it, not feeling it, not knowing it's going to happen until it's happened, kind of thing. So I went and saw, then that's when in those symptoms, like it's been years since I've been going to the bathroom all the time. Yeah. I mean, I never had like incontinence issues.
No, I know exactly what you mean.
To go to the bathroom.
Yeah.
You know, and I just figured like, okay, that's from having kids.
Yeah.
Like, you know, my bladder.
Forget jumping jacks or.
Oh yeah, no.
Jumping on a trampoline. That's not happening anymore.
I remember even when we were at Trinity Fitness and they would have us do jumping jacks and stuff, and I'd have to stop in the middle of them to go to the bathroom.
I wouldn't do them.
I can't do this.
I wouldn't do them. Or high knees, jumping jack. I'm like, I'm not doing it. Give me something else.
Yeah.
Like, I'm not doing it.
Yeah. And that was years ago.
Jump rope. Forget it.
Yeah.
Mm-hmm. Years ago.
Yes.
Yeah.
Mm-hmm.
So looking back, you said like the not incontinence, but like urgency.
Urgency was definitely.
Do you remember some other symptoms once you figured out like what was going on? Do you remember like what were some really hard symptoms that you had to deal with?
Well, afterwards, it's because once it gets to that point, it just gets worse. Especially for me because I've always played tennis, so I do a lot of pounding. So I could imagine if somebody runs or does a sport that requires like a lot of physical exertion. And I also, I mean, being a single mom, I do stuff by myself all the time. Like I move heavy stuff, I do stuff I probably shouldn't be doing. Like everybody's always like, why are you, you know, I'm like, well, I need to get it done.
Yeah.
Like, you know, and my son helps me now, but like for a long time I'd do that. And I knew like it would make my back hurt, but I can imagine that straining because that's part of that is, you know, those muscles are just getting weaker and weaker and pushing against everything as you're doing that stuff. So I think, you know, I probably did a lot of stuff, but one of the things that I hadn't realized is there was a heaviness.
Okay.
Like a fullness that like maybe I didn't feel before.
Can you point like in your lower abdomen?
No, it was just like inside of me. Like you could just feel like a heaviness.
Okay.
And like, you know, and then once it got to that point, it's like you just feel like there's something in the way. You know, like it's not how it's supposed to be. And it just feels like you feel different all the time.
Was it pain?
So there were occasions where it was very painful. It would mainly be after physical activity because it would be so low and out that sitting down would hurt. I did have like a lot of pelvic discomfort.
Sure.
But from what my current doctor had said, some of that was from the first surgery I had. And this was in between everything, which is kind of jumping ahead. But some of that was from that first surgery. And then some of it was also because I had so much going on, the muscles inside of me were out of control, like basically spasming and just having, like I was having severe, almost like muscle cramps or muscle spasms there. So, and it wasn't like cramps like like when you had your period.
Like PMS cramp, okay.
It was like a totally different kind of pain, and I don't really know how to describe that.
Sure.
Because it was like, it would be like sometimes I'd just be walking and I could feel like this pain in my pelvic area that just hadn't been there before.
Did you feel like you had to sit down? Like there was an emergency to sit?
No, never really like that. It was just like how much discomfort can you deal with?
Sure.
You know, like, and it would come and go. So it was like sporadic, but the way that was explained to me is like, well, it's just like if you have a muscle cramp or a muscle spasm, and then it finally kind of relaxes or does whatever it's supposed to do, and you're okay again. But yeah.
So how did it affect your daily life? Like, how did that look? What did that look like?
So at first it wasn't really bad. And I guess we need to to say that I had that first surgery. So that's a good question. So how long? Because it was definitely different after I had that first surgery.
Okay, so how first symptom or that was like in the shower.
Yep.
So how long between that shower incident to your first surgery?
That was like in April, and my first surgery was in December.
And what did he?
It was a he. Yes.
And it was a urologist, I'm assuming?
He was a urogynecologist.
Okay.
Yep, it's a very specific.
Right, okay.
Yeah, there's not very many of them around.
So what did he tell you was your diagnosis?
So my diagnosis was, the first time, was that I had the cystocele, which is the prolapsed bladder.
Okay.
I had a prolapsed cervix and a prolapsed uterus. So the goal of his surgery, which he was supposed to go in laparoscopically, that didn't happen. He was supposed to put in Y mesh.
Okay.
That didn't happen.
To like support, right?
To support the vaginal wall and hold everything up. Instead, which I had an awful experience, obviously, with this first surgery, and at this point, with how much I had wrong the second time, like, I don't know if my original diagnosis was actually accurate.
Okay.
I probably did need a hysterectomy because I did have so much going on, but at that point, after I had that surgery, nothing was fixed. So to me, it was, okay, did I really need a hysterectomy and to go through that? And, obviously he didn't fix what he was supposed to fix. Yeah. He said I had too much scar tissue to go in laparoscopically. And
did you have a C-section for one of your kids?
No. So I've never had any stomach trauma.
So where was the scar tissue from?
I didn't have scar tissue because the second doctor made 7 incisions laparoscopically and had no problems getting through my stomach to get in there. So
so your first surgery was a total hysterectomy?
It was so this is another. They were leaving my ovaries, and they were supposed to take everything else.
Okay.
When I got done with surgery, he had left my tubes because he said he couldn't get to them. I'm on a table. I'm not really sure.
And he opened you up. It wasn't laparoscopic.
No, he did it vaginally. So I didn't get opened up.
Oh my gosh.
It was all done vaginally.
So sorry. Like, this is like.
Yeah, it was like, and afterwards, I've told you about this, but I had a hysterectomy and I bled for over 2 weeks, like longer than 2 weeks. I had many, many different episodes of bleeding, clots coming out, things that shouldn't have happened. Even talked to an anesthesiologist that's from Mayo, that's a friend of mine, and she said the minute he saw that you were saying that you had bleeding, he should have had you back on a table. Like, there's no reason for you to be bleeding after a hysterectomy like this.
Like where are you bleeding from?
Like, where is it coming from?
Right.
They kept telling me it was from what they did instead of the Y mesh that they were supposed to do is they put 2 permanent sutures in that were supposed to give some support to hold up.
Like an anchor or
almost
whatever?
Like an anchor, yeah.
But anchoring what? Like anchoring your bladder or anchoring your...
It was supposed to be anchoring lift up the pelvic floor. So it's like from the top, like kind of where your cervix is, pulling up into
almost like an internal tummy tuck?
Kind of, I guess, maybe, pull it up a little bit. And there's supposed to be permanent stitches.
Okay.
They kept saying that the bleeding was caused from where the stitches were inserted. And this was over Christmas.
That's like a day of bleeding,
I'm going
maybe.
over Christmas, and I'm like, it's literally like, I took pictures because I'm like, I felt like it was a murder scene some of the time, I'm like, this is really, really awful. Like,
so sorry.
Didn't know what to do, and he's just patting me on the head like, oh, it's fine. Well, it's not fine.
No.
Like, there's something wrong. Like, this shouldn't be happening. But eventually it did stop. But then I had episodes after that like before we went on that trip for spring break, which was, that was March.
Okay.
I had the surgery in December. So 3 months later, where I was just sitting on the couch and stood up and soaked in blood again. And that time they told me I passed a scab. I can't make this stuff up.
So wow.
Like, it's one of those things you're like, okay. And, and still getting the pat on the head, like, you're just a hysterical woman. And I'm like, I'm really not. I'm pretty good about stuff like this. Like, I spend a majority of my day in pain with joint pain. Like, I know what pain is, and I know what pain I can take and what pain I can't. And like, when something's wrong, like it was, for the longest time I didn't speak up for myself. And I feel like I'm getting better about doing that, because if you don't, like, no one, they just, like, literally some of these doctors just make you feel like so, like, try to belittle you in so many ways and make you feel like you're hysterical. And I'm like, I'm not. But
like, this can't be normal.
No.
Yeah.
Like, and this was one thing between him and my other doctor. He's like, women just have to learn how to deal with this stuff. And I went in, when I went to see the doctor at Mayo.
Oh my, okay.
Yes.
That, he actually said those words.
Yeah. Yes, he did. You just
Go on.
have to learn how to deal with this stuff. Yeah.
I don't know what to say to that. Okay.
Yeah, I was.
And you were probably by yourself. And then, like.
I was, the first thing, he never came and saw me in the hospital. It was an overnight stay in the hospital. He called me.
Not even to do rounds once?
He called me on the phone and said, if you have stomach pain, let me know, because I could have nicked your colon when I tried to go in laparoscopically because I couldn't see anything. Let me know if you have stomach pain. Like, okay. And my packing got left in, which was a whole nother thing I had to deal with at home.
I'm not laughing.
No, it's like, just, like, at some point though, it's like, it's so many, like, so much of a calamity of errors and things that went wrong that it's like, you have to, like, what else are you going to do at that point? Wow. But pulling out packing, I'll tell you, is not fun. Like,
but probably by the time you realized you had to, it was like,
it hurt.
Stuck.
It hurt, yes.
So you had to, like, pull.
You're feeling it, like, pull against.
Yeah, so it's probably like adhered to your internal skin.
And you
like,
just had this surgery.
Yes.
That's like, yes. Because I had it in for like probably a whole extra day than what I should have had it in for. But when I went to take the shower, I was like, okay, I don't think this is supposed to be here. And the doctors, I had his phone number because it was during the holidays. And I text him and tell him, and he's like, oh, I bet you feel a bunch better, but I'll call you in some more pain meds. It's like, that probably relieved a lot of pressure. That wasn't supposed to be there. They should have taken that out in the hospital. Like, okay.
Wow.
And I was like, is that all that's left in there? Because,
Sure. Anything's on the table at this point.
Yeah. No, it was just, it was kind of insane.
Wow.
But what I was going to say is the difference between that doctor and the doctor I had at Mayo is I walked in and I said, well, I guess it's just something I have to deal with. And she's like, absolutely not. It is not something you have to deal with. It is something we are going to fix and we are going to make it right. And that was her, she's like, do not invalidate yourself and think you just have to deal with this, because it's not something you have to deal with. It's something that we can fix.
So, and here's the thing that I keep hearing over and over again of women midlife dealing with X, Y, and Z, right? Mm-hmm. Yours is an extreme case of like, holy crap, right?
Yeah.
So I feel like that's a common thing that we hear doctors say. And listen, I'm pro doctor. Like, they're practicing medicine, right? Mm-hmm. Like, that's what it's called. There's good accountants and bad accountants, and there's good, right? Like, there's good OTs and everything. Right, right. So, like, it's not anything like that. But I just feel like there's something about women in midlife talking about hard things, and either they just don't know, so they just say this is normal, or they just don't have time in their practice to troubleshoot, because sometimes it just takes time to figure out what's really going on, right? But I just find it, more than anything else that I'm discovering, that's what women hear in doctor's office of okay, well, this is just you now.
Yeah.
This is just something you have
Like,
to
it's
deal
just
with or
something-
figure out or live with
Like,
or
live with it.
manage or what. And I'm like, but why? You don't say that to anyone else.
Yeah.
Like, you don't say that to, you know, someone who's struggling with depression or, I mean, maybe you do, but you know what I mean? Like,
just,
but I'm just saying, like, why is something dealing with all the things that we have to do? Why is it this one thing that we hear that over and over and over again? And why do we have to become like layman medical experts,
like advocates for ourselves, and
to
like,
find a doctor who will
Mhm.
listen to you?
Yeah.
Like, I just don't understand what it is about this stage of life that requires like begging people to listen to you.
Right. And I think it is finding the right doctor, because I definitely the second time found a doctor that listened and took care of me and helped me, because at that point between the first surgery and when I started seeing the second doctor, like it just like rapidly declined.
And how did that affect your mental health?
Well, it's one of those things, like you know, like I am single, so you know, my friends are like, why don't you date? And I'm like, no, like I'm good. Like, I don't want to have to explain to somebody what's going on with me. I don't even feel that good about myself. You know, you're like literally walking around with the ball between my legs, like I'm okay right now. Like it's enough to make you feel, you know, and you feel like, I don't know if the right word's unclean, but you feel like,
no, I know exactly what you mean.
Like just not like, just always feel like kind of ick. Like just gross.
No,
like,
I know exactly what you, my second, so I've had 2 C-sections, and mine is a little bit lesser degree, clearly, but 2 C-sections, and my body doesn't do well with abdominal surgeries. First C-section, infection, but cleared fine. Second C-section was so traumatic that they had to open up the incision from hip to hip and let it heal from the inside out. So I literally had a gaping wound in my abdomen for 5 months. My husband had to pack it. Like, it was traumatic.
Yeah.
But I was perfectly hygienic, but I felt just
disgusting.
Dirty.
Like gross.
I just felt like, I don't know how else to, you just feel gross.
Yeah.
No matter what.
Yeah.
There's just something so, I don't know if it's the femininity or if, I don't know what it is, but it's, I know exactly how you feel.
It's already hard enough to feel good about your body, like especially when you're going through midlife for most people, like, and to have something extra that's just making you feel worse about yourself. You know, like I already hate my little flaps in my arms, like in the pictures. You know, like why do I have to have something else wrong?
And it's completely out of your control.
Yeah, like you know, like I could go work out and try to get rid of those.
I mean,
to a certain extent, but like you know, like totally out of my control.
Yeah,
like you know, just waiting for somebody to come along that'll actually like do the right thing.
Okay, so from your first surgery to your first appointment with your second doctor, how long?
That was, let's see, December to July.
And how did you hear about the second doctor? What prompted you to get a second opinion?
Should have gone to this doctor in the first place. I was actually recommended to this doctor by the anesthesiologist that I know, that I play tennis with. Originally, she had recommended her, and I didn't go because I was already at Baptist South with my OBGYN that referred me to the urogynecologist there. It was on the same floor. It was closer. It was, you know, they had all my records. I was like, okay, you know, like
insurance is fine. Yeah, it's all the things.
It was all the things.
Yeah.
So I found her through a friend that knew, and she's like, you need to go see her. Like, what happened to you is not okay. What's going on with you now is not okay. So it was July, and it took all the way from July until I didn't have the surgery until April. Is that right? May, June. Maybe I had it in March. I can't remember now. I get confused.
The second surgery.
I get confused with my surgery and my dog's surgery.
Oh my God.
Track of it was March or April.
So how long between your first appointment with your second doctor and your surgery?
That was July to my surgery was in. The surgery was April. It was in April.
Okay.
So it was from. Yes, it was because that was my brother-in-law's birthday. It was So it was from. What did I just say? From July. I had my first appointment with her in July, and then had the surgery in April. But there was a lot.
That's a long time.
Well, there was a lot going on.
Oh, okay.
There was a lot of. They do a lot of testing. I had to go through pelvic floor therapy to try to calm down, like what I was talking about.
Okay.
With the,
okay. Did you have to go to PT?
Yes.
Yeah. Okay.
So because my second diagnosis when I went in was I had, now at this point I had, not only did I have the cystocele, which was the prolapse bladder, I had a rectocele, which is prolapse your
rectum
coming through. I had vaginal vault prolapse, which basically means the whole side of both sides is just kind of falling. And severe muscle spasms, like I was saying, that were causing some of the pain. This point when she examined me, the stitches weren't even, the permanent sutures, one of them wasn't even attached anymore. And one of the reasons I went and started seeing her is because I was in so much pain.
How could you not be?
And so she actually took she took the stitches out in the office. She's like, I really think this is going to help a lot of your discomfort. And eventually it did. Like once everything calmed down, I did the pelvic floor therapy, which is...
It gets all up in your business.
It's a humiliating experience. It's not supposed to be, but it kind of is. I mean, you really do have somebody basically trying to train you how to use those muscles, and it's very like...
They get all up in your business.
Oh yeah. It's
and even after having kids, where like there is no
shame and like you have no like you're like, okay, whatever.
There is nothing someone hasn't seen in my body.
Exactly.
Yeah. But no, pelvic PT is amazing.
Right.
It can do amazing things, but it is like if you're not prepared for what they're going to do with you, it's something.
Yeah. I'll say it's something.
Yeah.
Something I don't ever want to do again.
Yeah, sure. Sure.
Good.
So they had you do a lot of testing, PT, all that kind of stuff.
Well, because at that point, the tests that I had done, so they always do 2 tests when they're going to do a surgery like this. There's one that's like urodynamics test, which is basically you go in a room and pee in front of somebody, which is another fun thing. There's a lot of catheters involved, so it's not comfortable.
Okay.
They like fill up your bladder, make you cough, make you, like bear down stuff to see if you have
leaking.
Basically, it's to see if you have any incontinence, which I did not. But that was the second time I had to do that test because they're only valid for a certain amount of time. So it was past the point of they needed a new test. They also do a test where they go in with a catheter, look at your bladder, make sure that your ureters are coming into your bladder, that everything looks good with your bladder, so that there's not any just to make sure that everything looks good from that point before they do anything. And so that testing has to be done. I had to do the pelvic floor therapy and then go in and make sure that everything, because there are different levels. If the pelvic floor therapy hadn't helped, it would have been, they would have done suppositories with like a muscle relaxer, and then there was another step, and then the final step was actually Botox injections to make those muscles like relax. Because and the reason she wanted to do that was to make sure that I didn't have another unsuccessful surgery. Because she's like, if these muscles are freaking out, like when I go in there, it's just gonna it's gonna set it up for failure, possibly fail again, like not work.
Sure.
So it was one of those kind of things, but.
Wow. So you had to do,
It's
so from July to April, you had lots of things happening. And then she's like, okay, it's time for surgery.
Yep. Yeah.
Wow. Okay.
Yep.
Like, I just can't say how sorry I am more. And I know that it doesn't, but my heart just breaks for you that was your life and that's what you had to go through.
Yeah, and in between the time when I started seeing her in surgery, I had some other stuff that happened. I ended up having a polyp.
Oh, wow.
I was playing tennis. It was in December, I think, and it's a vaginal polyp, which I didn't know existed.
I didn't know that was a thing.
Yeah, and I'm playing tennis, and I thought I had actually peed myself, which was weird because I'm like, I don't actually do that, and went to the bathroom in the middle of a tennis match and was covered in blood. And was like,
how did you not start panicking?
I was panicking because I'm going, don't have a uterus, don't have, where is this blood coming from? Like, what's going on? Why am I bleeding like this? And the other people around me, they're like, are you okay? Do you need us to drive you? And I'm like, no, I'm just gonna go home. I'm gonna call my doctor. Figured out. Well, they brought me in and they did an exam and they said, well, you have a polyp. Polyps can do this. They're really tiny, but they cause a lot of bleeding if they burst. And they're like, it probably burst because you were playing tennis and like the exertion.
What's the treatment for that? Just
they removed it.
Okay.
It was an in-office procedure. They just snip it off, and it's kind of like, I would equate it to like if you like having your cervix, that kind of like feeling when they go and scrape your cervix, and it's like that, your whole stomach drops, and you're like, It was a quick like kind of like that kind of thing, and I was like, well, let me see, really tiny, because I asked her to see it. I was like, what is this like thing? And it's literally like, it was like a little tiny like.
So you figure like, because you know your female organs are so vascularized, there's so much vascularity down there that it would make sense that it's a heavy bleeder, right? Like,
like it's just, you know, and plus I was exercising at the time, so I'm sure that made it worse because obviously like I'm
more blood flow, no, wow.
So, but I had it all. That's what I said. I'm like, if you want to go through it, I probably had like just about everything that could happen.
Okay, wow. So we're up to the second surgery.
Yep.
Was that like just did you spend the night at the hospital or
I just spent the night at the hospital again. She did end up, she had asked me, she goes, well, why didn't the first doctor remove your tubes? Because that actually reduces your risk of ovarian cancer by like 60% or something, which I didn't know. I think it was 60%. It was a really high number. And I'm like, well, he just said he couldn't reach them. And she's like, okay, well, we're going to reach them, get those out. Because there's no reason for you to have them.
Right.
Like you have nothing else.
Right.
You know, I'll check your ovaries, make sure those look good. But yeah, so she went in, it was an overnight stay. It was laparoscopically. Even though I didn't have incontinence issues, she did go ahead and do the bladder sling and the urethral sling, just because she said, because I play sports, because of everything, that my likelihood would be, my probability would be really high that I would start having incontinence issues. And, you know, I'm like, I will sign off on I'll sign off on the Bible, like for you to do, you can do whatever you want.
Right.
Like I would really like to just be here one more, like do this and be done. Like be done seeing you and done with this whole process. So she did, it was a 3.5 hour surgery, which was a lot longer than I think it was supposed to be. My mom was actually a little bit freaked out because she was waiting.
Like, what's happening?
Yeah, like why you told me she'd be out by this time. It was much later. Ended up that she did the two slings. She did the mesh, the Y mesh, took out my the tubes, and then also did stitches. Okay. So I had stitches to help try to repair because the damage was so bad from the vaginal wall.
Permanent stitches, or is it like dissolvable stitches?
No, they were dissolvable. Yeah. Some of those came out because they told me that would happen. Like I might have some like not bleeding, but like, you know, like a little bit of pink something coming out with stitches.
I mean, it makes sense. Yeah. Like that kind of stuff. Yeah. That kind of stuff is totally normal. Makes sense.
Yeah, but nothing heavy. Like nothing. It shouldn't be anything like what I experienced before with clotting or anything like that. It should just be like you might have stuff. You know, like but it's fine. But yeah, so did all of that. 3.5 hours. 12 weeks of basically doing nothing. No lifting over 5 pounds. Okay. No, you know, like you can walk, but don't do anything besides walk. You know, you can walk your dogs, you can walk around the block, but don't go to the gym.
So she didn't send you to PT or any of that kind of stuff?
No, it was just rest.
Yeah.
Like you need to rest and you need to stick with it, because if you don't rest, like, you know, I guess because gravity, I mean, you know, like if you do anything like that, gravity's going to take hold and it could cause a problem. So I actually behaved, which for me,
it's like unlikely for you.
For me with surgery is not like, I'm not normally the one that behaves. Yeah. So I'm normally like already up, like doing stuff, but no, I behaved because I don't want to go through it again. No. And I feel so much better. Like it's just so much better.
So obviously she fixed the problem. Everything is fixed.
Yes.
Praise Jesus for that. Like,
yeah, no, it's definitely like, I feel so much better. Yeah. Like, it's just
do you have any symptom? Everything is fixed. Everything is resolved.
Everything's fine.
That's amazing.
Yeah.
Yeah.
Yeah. After going through that and just being, you know, told at one point that just
this is what women have to deal with or whatever.
Just deal with it.
This is what did he say? This is what women.
It was like, this is what women just need to learn how to deal with this stuff.
It's wonderful.
Yes.
I love it when men say things like that.
Do you have any of this?
Wow.
Like,
okay. Oh wow. Okay. Wow. So that's a lot. It's a lot to process, and probably like I'm sure you've told the story a few times, right? Mm-hmm. Is it ever not feel like I can't believe that happened? Like,
I think everything happens for a reason. Not that it needed to happen, but at the same point, like I feel like people don't talk about stuff. I feel like more and more women are actually now getting together and actually opening up about this stuff, but you're so embarrassed about it. Like, you don't want to talk about like what's going on, and so to start being empowered, like have people talk about it, because like I don't want someone else not to know, like, or to think it's okay, or that they need to walk around like that. It's just like with my friend that, she had severe incontinence issues and was like basically peeing herself all the time, my best friend. And, we all sit there and laugh at her and she laughs at herself, but we're like, you can go get that fixed. Like, you don't have to live this way.
Right.
So, like, I think that's the main thing is like, just know that like you can talk to other people about it. And I think more people will open up and be receptive to hearing about it, even if it's embarrassing, like, because it's not easy to talk about, like, it's a very personal, like,
vulnerable,
like, and which is hard, but I feel like I've gotten a lot better. I know when I was younger, I would have been so embarrassed, like, I never would have been, but at this point in life, I feel like I just want other people to know it's okay, like, and that if you have something like that going on, like, there's people that can get it. You don't have to just deal with it. Like,
so because my next question was going to be, a takeaway, like what would you encourage women experiencing issues? So, don't keep it to yourself.
Like, don't keep it to yourself. Talk to other people, find out from other people. I definitely would recommend checking out more than one doctor, especially if a doctor makes you feel uncomfortable. Not uncomfortable. He never really made me feel uncomfortable. I guess he did a little bit. But
there's a little bit of dismissive.
Like dismissive, like not hearing what you're saying. Or, even the PAs in that practice were kind of like dismissive.
But if he's the top, right? And I can say, I think you can say that about any organization, family, church, whatever. The culture is defined by whoever is at the top. Well, so if that is how he interacts with patients, then it's going to trickle down, right? And if the people that work for him, it doesn't, then they leave.
Right.
Because they don't like the culture, right? So it's really dictated top down.
Well, and I think too, like, I can tell you from sitting in that waiting room, by far, 90% of the time, I was by far like 20 or 30 years younger than all of those patients.
Really?
Yeah. Like, I mean, at least 20, maybe more, like years younger than a lot of the patients there, because a lot of them were older ladies dealing with problems, which probably are used to that kind of culture, like, thing, whereas I'm at a point in my life where I'm not going to put up with it. Like, I don't need this is probably some of my single momness going through, but like, I don't need a man to tell me like what to do or it's okay,
right?
Like, I just don't accept it, because you can't tell me how I'm supposed to feel,
right?
Or invalidate what I am feeling. Like, it's not okay. So
when there's clearly something wrong,
right?
Like it's I'm not making it up. Like,
like clearly something's going on here,
right? Wow.
But definitely just talk to your friends about it. I always equate it to like when I first started having children, I was pregnant and had a miscarriage. People never talked about that. And then you start saying, like I would say, and somebody would be like, oh yeah, that happened to me. Like, that happened to me. Like, I think it's like 1 in 4 or something. A lot of times,
a very high percentage.
A lot of times you don't even know that it's happening. Like, a lot of people don't know. But at the same point, like, there's a lot of ladies that have gone through that and no one talked about it. And no one, like, and then you start talking, and then they'll start talking back. So it's like kind of, it opens up a dialogue between people when you start sharing your experiences and then, you may find somebody that is going through that same thing and just scared to talk. And it might make them feel like, okay, well now maybe I don't have to talk about it, but I can go. Maybe do something.
It's almost like giving someone permission to be like, okay, so I'm not crazy. this is great,
Right.
this is wrong.
Exactly.
I need it. Yeah.
Yeah.
So, and I think I've probably said this in almost every single podcast episode is, I mean, one of the biggest reasons why I started this podcast is because people don't talk about things.
Right.
For whatever reason, you know, either being embarrassed or vulnerability, or they just feel like, oh, suck it up, right? Like
Right.
there's that personality type too, right? But women need women.
Mm-hmm.
Women need women of all ages, of all seasons. I feel like, especially this culture, we live in kind of an individualistic culture, and a little bit of isolation culture. You deal with your own junk, right? Like
Right.
in that, and so I just feel like we do such a disservice to ourselves and to the women around us when we don't talk about things that are happening. And we can say that about, like, you know, when our kids are acting a fool, like,
Yeah.
you know, like, or X, Y, and Z, right? Like, we just, part of it is, I can only speak to myself, but for me, I think part of it is like, I don't want people to know that I kind of suck in X, Y, and Z, or I don't want people to know that I'm struggling. Like,
Right.
so there's a little bit of an ego thing happening
It's like
too.
that what you want to project of yourself.
Yeah.
It's like, you don't want to project that you're weak in some way, or
Right.
that you are struggle, or that you know, life isn't perfect.
Right.
Like this perception of like,
It's like this mask that
Yeah.
we wear of like however we want to project to the world of who we are. It just does ourselves and all the women around us a huge disservice. And, you know, part of my goal is obviously women of like in our age group or whatever to watch this, but also younger women to watch this and be like, oh, wow.
well, because I told, you know, like I was completely open with my daughter. Even my son knew.
Yeah.
Like, you know, like he kind of had to know just because of the situation we're in. But with my daughter, like I have told her all of it.
Yeah.
Like, because I don't want her to go through life like not,
Right.
you know, ask the questions if it's not right, you know.
And step in maybe that a little bit earlier.
Right.
Right. Like,
Right, like maybe she'll, like if this happens to her, like maybe
Yeah.
she will go in and get it checked out earlier, and you know, maybe not get as like far along as I did in the
Sure.
process where there was so much going on.
and then it's like asking the right questions to the doctors,
And
right?
that-
Like,
yeah, because when you don't know and they're not being informative and
Right.
they are kind of brushing you off, like you don't know those questions to ask, like because they're telling you like, no, it's perfectly fine. Well, okay, but
like, what do I know? Okay.
yeah,
like,
okay,
yeah.
you know, you walk away being like, okay, I guess like whatever,
Yeah.
you know,
yeah.
but
Yeah. Well, thank you so much
Yeah,
for being
you're
willing to
welcome.
come here. I love you, Julie. I think you're so awesome. This
Aw,
is such like a
thank you.
hard, vulnerable thing to talk about, and I'm just really grateful that you were willing to do that.
thank you.
You're
Yeah.
welcome. Okay, thank you.